Hi, welcome to the Dr. Paul Show. I'm Dr. Paul. Today I'm going to talk about full remission and what that means in the field of mental health. But before I get into it, please like and subscribe in order to stay informed about the topics that are important to you. So when I first see patients, one of the opening questions I ask them is, when did you feel the best in your life? And this question sometimes shocks people a little bit. They don't expect it. Because they have to really stop and think about it. And they sometimes say, well, what do you mean? I say, well, look back in your life. Where would you go back in your life where you felt your best, your happiest, the least stress, your best mood? Where would that be? And I hear a lot of different answers. There's two most common answers I hear. The most common I hear is elementary school. So why elementary school? Because in childhood, your life is more about having fun. You play with your friends. You go out. There's not a lot of worries in life. You're not stressed about things so much. Life's more carefree. Now this is again, if you have a healthy childhood. Now this is if you have loving parents that aren't abusive. So if you have a happy, healthy childhood, that can be a really happy time. The second one I hear is late teens to early mid-20s. Why then? Well, because you're out of high school, you're starting a career, you might be in college, or you might be starting in a career. And life's more about having fun. You go out with your friends, there's less stress. You don't have a lot as responsibility so much. As things might change later, like with marriage and kids. Not that that's bad, because it's great, but it's more stressful because life gets a little bit more complex. Now, people, when I tell them that I think I can get you back to that place, they don't believe me at first. They think, this guy's got to be kidding me. There's no way that he can make me feel that good again. What are the times I rarely hear? I don't usually hear middle school. I sometimes hear high school, but not usually. I sometimes hear 30s, but not usually. So why not? Well, again, like I said, it's when life gets more stressful, job stresses, financial stressors, relationship stress, breakups, loss of jobs. So there's a lot of very stressful things in life that happen to people. And so what I do basically then is I take a really good family history, because genetics gives me a lot of clues as to why the person's at that place where they are. So I take a really detailed history of their mothers, their father, their siblings, their grandparents, aunts and uncles, cousins, because family history is really, really key for me to understand why the person's at where they are at. I also ask about, other things about hormone changes. So why middle school? The reason middle school is not so good is puberty. So when people start having hormonal changes, women it happens more than men, which is also why depression and anxiety is more common in women than men, because women have more abrupt hormonal changes. So, but that's why middle school is often a very stressful time, because it's a whole change. Your feelings are changing, your emotions are changing, anxiety is happening more. And so that's why adolescence is a very difficult time for a lot of people. A lot of my patients I see a lot of people who are teenagers or in the early teen years because of this reason, because that's where a lot of chaos starts happening. That's where a lot of drug use starts happening. That's where a lot of behavioral problems start happening. So a lot of people I see also in midlife, and again, the other times of changes are, for women premenstrual. So that's why some women the week before their period have a lot of problems with irritability, moodiness. women after childbirth is a difficult time, and postpartum, and then women and men going through menopause, women going through perimenopause, so sometimes late 30s, 40s, 50s is a difficult time. And with men too, with men I call menopause or male menopause, which is also known as midlife crisis. So a lot of men also go through a really difficult time during those years because their testosterone is lowering and they're having their own hormonal changes different than women. And so when I tell people I can get you feeling back to that way, like as I said before, a lot of people say I can't believe that. I love trying to prove them wrong. So what I typically do is I'm usually able to get people back to that state of being within usually 2 to 3 visits, believe it or not. It sounds like unrealistic because I think a lot of people have this notion that with these medications that it takes weeks and months for them to work. That's just not true. The way I do things in my practice is I move very quickly. I make very quick changes because medications, and if you watch the show, you know that when I explain how they balance your neurochemistry. The point of balancing chemistry that's gone out of balance is that restoring that old feeling back again. So before those chemicals went out of balance is when the person felt their best. So my job with medication is to kind of get those chemicals back on the right track, going the right way instead of the wrong way. And that's what that's what psychotropic medications do. They're not addictive. They're very safe. But I'm able to usually figure out fairly quickly how to get people to that state. I start them on something. I talk to them a week later when they call me. And again, I work very, very quickly because my goal is to get them back to that state of being as soon as possible. Most of the time, I'm able to get people back to that state within 2 to 3 visits, within maybe 1 or 2 months at the most. Sometimes it takes longer if it's a more complex problem, but for the most part, it's pretty easy to get people back there. And when they are back to that state, and I'll ask them, sometime when they come back in for the next visit, I tell them, how are you doing? Oh, a lot better. I said, okay, you were telling me before that you felt better when you were at this state of, are you there? And they're like, either they say, yeah, I'm there. Great. Let's say, and if they say, I'm getting there, I say, okay, to quantify that, let's say 100% is there, and then 0% is where you felt your worst. Where are you right now? And some of them might say 50%, some say 75%. And then I'll ask them, okay, what's when you say 75%, what's the other 25%? What's not better? And when they tell me, well, this is not better, or I'm still not sleeping as well, I'm still having pain, I'm still having a little bit of anxiety. It might be that I need to adjust the medications better. I might need to add something into the mix. So usually, every visit, I'm thinking about how do I get this person to remission, and again, remission again is the state of total well-being where they don't have anxiety anymore. They're not depressed. They're sleeping great. They have great energy. They don't have pain. A state of being where they originally never thought they would get there, and they do, and they're shocked sometimes. And then when people get to that state of 90 to 100%, I think, and sometimes I do a little bit of tweaking, but other than that, I say we're good. And then now my goal is to keep you there. So then if I see them back and they slip back a bit, and they say I'm not quite as good as I was, I go, what's different? And they tell me, I go, okay, I think maybe the dose is too low. Let's adjust this. So I'm able to figure out fairly quickly how to get people to remission and keep them there. A lot of people have been to doctors who tell them, oh, this medication will take about 3 months to start working. That's never been true. That's a myth in this field of medicine, is that it takes medications long to work. With the medications that I work with, if you know what you're doing, you get results within the first week of taking them. Maybe at the outside 2 weeks, but normally within 4 days even you see results. So they work a lot quicker than people think, and I think a lot of doctors are not aggressive enough. They do like, okay, we'll start you on this, and then a month later we'll go a little bit higher, and then over here. So then we're taking like 3 months to get to a place where they're not that much better, and okay, well, let's stop it and try something else. So now we're going months and months without the person getting better, and that person might either give up at that point and say, well, this is not working for me. Well, it's not that it's not working for you. The doctor just doesn't know what they're doing, and they don't know how to do this correct. They don't know how to be more aggressive, or they have this notion that they have to take things very slowly. That's all nonsense, okay? If you're seeing a doctor who's not getting you better quickly and just doing the same thing over and over again, it's time to change doctors, because obviously the doctor doesn't know how to do it correctly. And that's a lot of doctors, okay? Not just primary care doctors, sometimes also psychiatrists. My focus is not only the emotion, but also the physical body. And a lot of doctors don't do that. They don't think about the headaches, the neck and back pain, the fibromyalgia, the irritable bowel syndrome, all these things that people have that are mystery illnesses because doctors don't know what to do. So they'll give people pain pills, they'll give people things that are going to get the symptoms better, but not cure the problem. I'm constantly focusing on the balancing of the system, because once you balance the nervous system properly, then a lot of things fall into place. And so again, I don't rest until people are there, and once I get them there, I want to keep them there. And it's amazing if you do it correctly, the patients are just so overwhelmed and happy and excited, and then they tell their friends, and then I get a lot of referrals from people who come and see me and say, hey, can you do for me what you did to my friend? I can't believe the difference in her or him. Can you please help do that? I want that for me. I love to hear that, because I love doing what I do. I love seeing the results firsthand. It's always exciting to me. I never get tired of it. And that's what drives me to keep doing what I do. So that's basically full remission, what that means, and it's the goal for every patient I see. Every visit with every patient, I'm always thinking about, how can I get them closer there? If they're not there yet, what can I do now to get them there by next visit? And sometimes, you have to make choices that it's not the right choice. I give them something that didn't work, okay. It's trial and error. Because the thing about this field also, there is some trial and error. I have to try things to see if I'm right about something. And it's rational trial and error, but it is still trial and error. And that's what science is. Science is basically all about that, because we don't have in this field, we don't have blood tests, we don't have scans. We have you telling me what's wrong and me trying to figure out, is it something I can do to fix it? And a lot of the times people get frustrated because they go to the doctor, they get a bunch of blood tests, the doctor says everything is fine, we can't find anything, there's nothing wrong with you. And the person leaves frustrated because, what do you mean nothing's wrong with me? How can I feel like this? And you say nothing's wrong, but there's got to be something wrong with me. Well, yeah, there is something wrong, but the problem is the doctor's too focused on the tests and not listening to the person and looking at a piece of paper and saying, well, there's nothing I can do because all these things are normal. Well, those things are just a very small part of a person. That's the blood system. This is the nervous system. It's a whole different system that you can't test in that way. So in what I do, the medications are the tests and they're also the treatment at the same time. And that's very unique in medicine. And there's no other field of medicine that's the case. Because everything else in medicine, you do something according to a test. My test is listening to my patients. My test is patients telling me what's wrong, and so the patients are the test, and they drive me to be able to try to figure it out based on what they tell me. That's why with doctors you have to have good listening skills. I do a lot of listening. On the show, I do a lot of talking, but the basis of what I do is listening, and that's the basis of communications is listening. And if a doctor's not a good listener, then they're not going to be able to do this very well, because there's no other way of doing it. So I hope you enjoyed this video, and please, if you liked what you hear, please share it with your friends and family. And if you have any questions or comments, please send them to me. I answer every question and every comment, and love to hear from you. And thank you for listening. Hi, this is Dr. Paul of the Dr. Paul Show. Today I'm going to talk about self-medicating. What does that mean? But before I get into it, please press like and subscribe to make sure you're getting the most up-to-date information and material. So today I want to talk about self-medicating. This is a topic that I see very, very frequently. I'm basically talking about drug use, alcohol, and now there's a lot of people out there that can social drink. I mean, I like beer. I don't overdo it. I do a little on the weekends. But, you know, in the case of alcohol, some people take it too far. Sometimes instead of a glass of wine, it becomes a bottle of wine every night. Instead of a couple beers, it becomes 6 to 10 every day, and not just a weekend, then every day. So, and then there's other harder drugs. There's a lot of opiate use out there, from opiate pills like, you know, pain pills, and to the street version, which like heroin and fentanyl. Very dangerous. Fentanyl is one of the #1 killers of young people in our society. And there's methamphetamines. There's cocaine, there's marijuana. So why do people, when I say self-medicate, what does that mean? Well, again, when people are doing drugs, they want to feel better. That's the point of doing them. They want to feel a certain state of being. So when people are anxious, what do? When people have anxiety, they drink. You know, because people know that, when you go out and to meet people, if people have, let's say, social anxiety, and they go out to a bar and they want to meet someone, after 2 or 3 drinks, they feel better. They feel more relaxed. That's what we call liquid courage. And then they can talk to people easier. And then if someone feels anxious, they may smoke marijuana. Now, some people can do it here and there, occasionally here and there, and then some people do it all day, every day. And there's a lot of other things like tranquilizers. Some people will get, on the street, they'll get Xanax, they'll get Klonopin or Ativan and use those and then overdo it. All those things are to self-medicate anxiety. Let's say someone's depressed. What do? Well, sometimes they'll do uppers. They'll do methamphetamine. They'll do cocaine. And so, other forms of speed. Some people do mega doses of caffeine, lots of power drinks. So when someone wants to get to a state of being, they can use substances in order to do that. The problem can become is addiction, and some people get to the point where they have to do certain drugs in order to stay in that state, and that's what happens. And the number one killer statistically is alcohol. Number 2 is fentanyl, by the way. And people hear about fentanyl because it's killing so many people. Ever since it took over, now it's really actually hard to find heroin anymore, because fentanyl has flooded the streets. Basically, China sends it to Mexico, the ingredients, and the cartels basically have been able to get it through the open border, the last administration, quite easily through the border. Now it's more difficult, people can do it in labs. People have their own laboratories where they can make it. But since fentanyl's been around, it's really hard to find heroin anymore. So these are very dangerous drugs. And the problem with opiates is they're extremely addictive and very, very difficult to get off of. And so when people go into, let's say rehab, if they get to that state, hopefully they don't die from it, then if they stop the addiction, well, now you have to replace it with something. So then we have to get to the point why did the person fall into that addiction in the first place? Well, usually there's an underlying mood disorder. There almost always is. There's a term called dual diagnosis in this field of medicine. Dual diagnosis means you have an addiction, but you also have a mood disorder. I've always thought that the term is pretty ridiculous, because anyone who has an addiction issue is pretty much almost 100% of the time has an underlying mood disorder. Now, there's some people who get sober, let's say, in AA, and let's say they don't treat any mood disorder, but then they switch to a different addiction. They switch to gambling. They switch to smoking. I mean, nicotine is again a huge addiction, and probably one of, if not the most difficult one to stop. But a lot of people in AA are smoking cigarettes. A lot of people they're doing power drinks. They're gambling. They develop sexual addictions. So there's a lot of we call cross addiction. So sometimes people beat one addiction, they switch to another addiction. And like I said, marijuana is now it's legalized in a lot of states, including California, so it's very easy to get. And again, some people can do it here and there, and not fall into a pattern where it gets more and more. But like I said, some people use it as their medication, and when you ask them, why are you doing it all morning, and they say, well, that's because I have my anxiety. They'll tell me. They say, well, it's the only thing that works for my anxiety. And when I say to them, well, I can help your anxiety in another way, and some of them are very hesitant. They go, no, this works for me. I go, yeah, it works for you, but we're not fixing the problem. I call it band-aiding a problem. We throw something like a band-aid on a wound. And I use the example, I say, if you had like an abscess on your arm or in your leg, and there's like pus coming out of it, and you squeeze the pus out, you put a Band-Aid on it, you put a little bit of antibiotic ointment on it, you put a Band-Aid on it, and you keep doing that every day, and then we would look at that and say, well, why don't you take an antibiotic? That you might want to get that fixed. And no, this works for me because I just squeezed the pus out and I put some other Band-Aid on. So basically, with topical treatments, like just for example, Xanax. Xanax is again very helpful for panic attacks. I do prescribe it in appropriate cases, but it can be overdone because people use it as their primary medication, and it's very difficult sometimes to get people to try to take something preventative because people say, no, this works for me. I don't want to take anything else. I don't want to take a daily medication. And I say, well, you're already taking a daily medication. You're taking this. Well, this is different because this helps me. So sometimes it's very difficult for some people to convince them to treat what they have. Sometimes I have to tell them I'm going to have to take you off of this if you don't, and unfortunately they don't like that. But I tell them, I don't want to keep just giving you a Band-Aid. I want to fix your problem here. And some people leave and they don't come back to see me, and I wish them the best, but I'm here to try to fix the problem. And so what I try to do is figure out, do they have an anxiety problem? Do they have depression? Do they have bipolar disorder? Do they have ADD? Now, for example, some people treat their ADD with methamphetamines. And they say they feel great on meth, and they say I feel calm, I feel relaxed. Well, that's because they're taking speed, and I say, well, look, if this is a bit controversial with someone who has an addiction to methamphetamines, but let's try you on an ADD medication, which is a stimulant, but it's much safer. And it's actually fixing the problem. It's actually treating the problem, not just, again, throwing a Band-Aid on the problem. And I have had a lot of patients who say, I'm great. As long as I take this, I have no desire to take the street stuff, which is great. That's a win. That's a big win right there. And then sometimes if you're not sure, you can drug test them to make sure they're staying on the program. So with me, when I see anyone with an addiction problem, I have to really, like I say, get under the hood and really try to figure out what's going on. And that means taking a really good history from the patient, trying to figure out what happened, what led to this. And again, if I treat the condition properly, then the addictions can really just go away. I see it all the time, and a lot of people who are alcoholics. They can get, the ideal is they don't drink anymore, but some people have gotten to the point where they can just have a drink here and there. Again, if you go to AA, that they're going to tell you no. Some people can do that and get away with it and be okay. Some people can do that, but it leads them right back to where they were. So it's very individualized what I'm talking about. So when I treat someone with addiction, it's very individualized, again, the approach to it. And if you want to learn more about this, I have a whole chapter on addiction in my new book, The Corona Protocol. Actually, the subtitle is a scientifically proven medical solution to stop addiction, bullying, homelessness, school shooting, and suicide. So I have a whole chapter on addiction and the treatment of that. And so if you want to get my book and read more about it in there. So anyways, but thank you for watching this. If you like what you saw, please share it with your family and friends. And if you want to have any questions, you want to make any comments, I answer every question and comment. And so please get a hold of me, and I look forward to hearing from you.